Hello, my name is Dr. Chapman. I am a board-certified rheumatologist, and today I'm going to help you self-inject Hyrimoz at home. This is a medication, biologic medication, and more specifically, a biosimilar medication. So it looks like Humira, but it isn't exactly like Humira, but it's used to treat the same diseases as Humira. So let's get to it. All right, so the first thing you want to do whenever you are self-injecting is to make sure that you have all your materials prior to even starting the injection. So that includes the medication, something to clean your hands, something to clean your skin, and also something to dispose the medication with. You want to take your medication out of the fridge for at least 30 minutes prior to injecting and letting it come to room temperature. Some people do 30 minutes, you can do up to an hour, really up to you. The next thing is to actually inspect the medication. So here I have two demonstration pens, or actually one pen and one pre-filled syringe, and we're going to start with the pen. It seems to be the most popular one. So this is how it kind of looks like. So you want to make sure that the medication is not expired, and that's usually on the medication box. You also want to make sure that it doesn't look tainted. So it should look clear yellow. It may have a bubble or two, that's normal, and it's okay to inject that way. But if you see some particles or it looks cloudy, you may not want to inject with this. If this happens, I would encourage you to contact the provider who prescribed you the medication or the manufacturer to have a replacement. So let's say you've done that. The next thing is to select a site. This is supposed to be representative of skin, and you should be injecting in your thigh or your belly. You want to be at least 2 inches away from your belly button. You also want to make sure that you're not sick at the time. So if you have an infection, you probably shouldn't be injecting this. If in doubt, always contact your doctor. So you'll take the first thing actually, you will want to wash your hands. Alcohol sanitizer here, and then you want to sanitize your skin. So use like just an alcohol prep pad, and with a circular motion, you want to clean the area. You also want to avoid any rashes, any moles. If you're injecting this for psoriasis, you obviously want to avoid the psoriasis. So you've done this, and what you want to do is hold the pen almost like basically like this. Not like a pencil, but basically like this. Next thing you're going to do is pinch the skin, remove the protector, and then pinch the skin, and then you want to press firmly down, not too hard, but just enough. And this particular pen is self-activated, so as soon as you press down completely, the medication will start going in. And continue firmly holding down for about 10 to 15 seconds to let the medication go down. You'll hear a second click. There may be a little bit of bleeding. If so, you could put a little cotton ball or simply place a Band-Aid. For those of you who prefer using a pre-filled syringe, it does come in this formulation as well. Like the pen, you want, basically most of it is about the same. So you want to wash your hands with some alcohol. You want to make sure that the medication is not expired and that it doesn't look tainted. You'll then want to wash the skin, again, thigh or the abdomen. This, however, now it changes. So now you want to pinch the skin again, but you're not going to go at a 90-degree angle. This time you're going to go at a 45-degree angle. So you're going to remove the safety cap, and then you're going to, in one like shot, just prick the skin and then press inside. And when you finish the whole thing, and then what'll happen is that the needle will stay hidden within the actual pre-filled syringe. And you take this as a sharp, so then you'll want to put this in a sharps container and dispose of it appropriately. The company that makes this medication, they do have a sharps program, so they can actually send you a sharps container, and then if you call a number, they will take it back for you. Otherwise, it really depends on your state. Here in New York State, you can usually you can bring your sharps to either nursing homes or hospital programs that will call in advance to see whether their program is up and running. So that's how you self-inject the Hyrimoz from the comfort of your home. If you have any questions or comments, please leave them in the comments section below. If you have any specific health-related questions about your personal health, I would encourage you to reach out to the physician or provider that is prescribing you the medication. Otherwise, thank you for watching, and I'll see you next time.